Have you ever wondered why some men have strong, firm erections while others struggle with weaker ones? Could the answer actually be in your kitchen? Is it possible that certain foods can improve blood flow, hormone balance, and ultimately erection quality? And if that is true, why do so few men actually know about it? Most men immediately think about medication when they experience erectile difficulties. Drugs like Viagra or Cialis often come to mind as the first solution. But what many people forget is that erections are not just about medication. They are about circulation, metabolism, hormones, and overall health. In fact, an erection is fundamentally a vascular event. It is all about blood flow. If blood can enter the penis easily and stay there, an erection becomes firm and sustained. But if circulation is compromised, erections become weaker, slower, or difficult to maintain. And here is where something interesting happens. Many of the biological mechanisms involved in erections are strongly influenced by lifestyle, especially nutrition. That means the food you eat every day can influence blood vessels, nitric oxide production, hormone levels, inflammation, and cardiovascular health. All of these are key factors that determine how strong or weak your erections are. So today we are going to explore a very interesting topic: 7 foods that may naturally help improve erection quality. Foods that support circulation, vascular health, and nitric oxide production, the same mechanisms targeted by many erectile dysfunction medications. But before we go deeper into this topic, let me introduce myself. My name is Dr. César Noval. I am a plastic surgeon and the director of Clínica NEF. I specialize in penile enlargement surgery and gender surgery. Our clinics are currently located in Spain, Mexico, and Miami. On our main YouTube channel, Clínica NEF in Spanish, we have built a community of more than 100,000 subscribers where we talk about male sexual health, penis anatomy, erections, medical treatments, and surgical options related to male genital health. We decided to create this English channel because we realized that many people around the world are looking for reliable medical information about men's sexual health. And unfortunately, there is still a lot of misinformation on the internet. Our goal with this channel is simple: to explain these topics clearly, scientifically, and honestly from a medical perspective. So if you are interested in erections, sexual health, penis anatomy, treatments, and everything related to male health, this channel is for you. Now let's go back to today's topic. Can food really improve erections? The answer is interesting. No single food will magically solve erectile dysfunction. Erections are influenced by many factors, including vascular health, hormone levels, neurological function, psychological factors, and general metabolic health. However, certain foods can support the biological systems that allow erections to occur properly. And when those systems are healthy, erections tend to be stronger. So let's explore the first food: leafy green vegetables. Vegetables like spinach, arugula, kale, and Swiss chard are rich in natural nitrates. When we consume nitrates, our body converts them into nitric oxide. Nitric oxide is one of the most important molecules involved in erections. In fact, the entire mechanism behind medications like Viagra is based on enhancing the nitric oxide pathway. Nitric oxide relaxes the smooth muscle and blood vessels, allowing arteries to dilate and increasing blood flow. When this happens in the penile arteries, blood enters the erectile tissue more easily, helping create a stronger erection. Leafy greens are one of the simplest and most natural ways to support this nitric oxide pathway. Next, let's talk about beets. Beets are actually one of the richest natural sources of dietary nitrates. When consumed regularly, beetroot can significantly increase nitric oxide production in the body. This is why many athletes drink beet juice before competitions. It improves circulation and oxygen delivery to muscles. In the context of erections, the same mechanism can support better blood flow to the penile tissues. Better circulation means better erectile response. Food number 3, fatty fish. Fish like salmon, sardines, tuna, and mackerel are rich in omega-3 fatty acids. Omega-3 fatty acids play a very important role in cardiovascular health. They reduce inflammation, improve endothelial function, and help maintain flexible, healthy blood vessels. This is extremely important because erectile dysfunction is often one of the earliest signs of cardiovascular disease. The penile arteries are much smaller than the coronary arteries in the heart. Because they are smaller, they are often the first blood vessels to show signs of circulation problems. Improving cardiovascular health with omega-3 fatty acids can support better vascular function throughout the body, including the penis. Next, let's talk about dark chocolate. Yes, chocolate, but not just any chocolate. Dark chocolate contains compounds called flavonoids. Flavonoids are powerful antioxidants that improve endothelial function. The endothelium is the inner lining of blood vessels, and it plays a crucial role in regulating blood flow. Healthy endothelial function allows arteries to dilate properly when blood flow increases. Several studies have shown that flavonoids can improve circulation and vascular health. This is one reason why moderate consumption of high-quality dark chocolate may support cardiovascular function. Next on the list are nuts. Nuts such as walnuts, almonds, pistachios, and hazelnuts contain several nutrients that support vascular health. They are rich in healthy fats, antioxidants, and an amino acid called arginine. Arginine is important because it is a precursor to nitric oxide. When the body converts arginine into nitric oxide, blood vessels relax and circulation improves. Some research has even suggested that men who regularly consume nuts may experience improvements in sexual function and libido. Another interesting food is watermelon. Watermelon contains an amino acid called citrulline. Citrulline is converted in the body into arginine, which then contributes to nitric oxide production. Because of this pathway, watermelon has sometimes been referred to as nature's Viagra. While the effect is certainly not as strong as pharmaceutical medications, it does demonstrate how certain nutrients can support the same biological pathways involved in erections. Finally, let's talk about olive oil. Olive oil is a cornerstone of the Mediterranean diet, which has been associated with some of the best cardiovascular outcomes in the world. The Mediterranean diet emphasizes healthy fats, vegetables, fish, and whole foods. Olive oil provides monounsaturated fats and antioxidants that support vascular health. Better vascular health means better circulation, and better circulation is essential for erectile function. But now let's address something very important. No single food will dramatically transform erectile function overnight. Erections depend on the interaction of multiple systems in the body. Blood vessels must function properly. Hormones must be balanced. The nervous system must transmit signals correctly. And psychological factors such as stress and anxiety also play a role. That means the most powerful approach is not focusing on one food, but on an overall healthy lifestyle. Regular physical exercise improves circulation and nitric oxide production. Maintaining a healthy body weight supports hormonal balance and cardiovascular health. Adequate sleep is essential for testosterone production, and managing stress helps prevent psychological inhibition of erections. In many cases, erectile dysfunction can be an early warning sign of underlying health issues. Conditions such as diabetes, high blood pressure, metabolic syndrome, and obesity can all impair circulation and damage blood vessels. When erectile problems become frequent or persistent, it is important to consult a physician. A proper medical evaluation can identify underlying conditions that may need treatment. At the same time, improving lifestyle factors such as diet, exercise, sleep, and stress management can significantly support erectile health. To summarize today's topic, erections are fundamentally a vascular event. Anything that improves circulation and vascular health can support erectile function. Certain foods can help support these mechanisms by improving nitric oxide production, reducing inflammation, and protecting blood vessels. Among the foods that may support erection quality are leafy greens, beets, fatty fish, dark chocolate, nuts, watermelon, and olive oil. But the most powerful strategy is combining healthy nutrition with exercise, good sleep, and overall cardiovascular health. If you found this video interesting and want to learn more about erections, penis anatomy, male sexual health, and medical treatments explained by a doctor, make sure to subscribe to this channel. Because in this channel, we will continue exploring these topics with real medical information that can help you better understand your body and improve your health.